Hi, I'm Tony Williams, and this is Brooklyn Savvy. Hi, I'm Tony Williams, and welcome to Brooklyn Savvy. On this episode, we're going to be talking about childhood suicide. And throughout this particular season, we've dealt with a lot of issues around mental illness. We did a show on Alzheimer's, we did something on community trauma, and now we're going to tackle what I think is a really painful issue, which is childhood suicide. So it's not an easy topic, but it's something that I think people really need to know about and check the signs for. And this is basically a community outreach effort on the part of Brooklyn Savvy to make sure that we are reaching the people that we need to reach, because we want this to stop. So with that, I want to introduce our Savvy panelista guests. We have Dr. Delrita Abercrombie. We have Dr. Shilpika Varma. Now, you are an adolescent and child psychiatrist.
Right.
And you are a clinical psychologist. I failed to say that. And we got a lot of doctors in the house. And then we have Dr. Brenda Bell-Boyd as well. And you are also in the
educator and counselor.
Excellent.
Mm-hmm.
So
Family
we're here
therapist.
to give you the best information that we possibly can. And what really alerted me to this was this article that I read in the Washington Post that said that childhood suicides had increased in the African American community. Delrita, can you talk to us about what that means and why?
They have become so insulated and isolated and exposed to so much violence. There's a high percentage of the children who do not, the children who do present as suicidal, there's a small percentage overall.
It's still small,
It's a small
right.
percentage, but there's an increase because of the psychosocial factors of the families of children whose parents are incarcerated. There are more programs for those. So the children are experiencing losses, traumatic losses, deaths due to violence and gunshots. You see it on the news all the time where, you hear stories about children who, witness their parents or their neighbors being shot in front of them, and they have to cope with having to go to foster care. They may be removed from their families. They may have also suffered post-traumatic stress disorder, so they have a lot of anxiety, nightmares. They have symptoms in
So how are these
school.
children killing themselves, though? Meaning, how does not that we want to put anything in anybody's mind, but what is going on?
What we're noticing is that more of the schools now are referring children who post messages on the social media. Mm-hmm. They either to impress each other or to gain attention. And the policy in the public schools right now is that if a child writes a suicidal note, says anything about killing themselves, they immediately call 911. They call an ambulance. The parent is contacted. If they draw a picture that has violence in it, guns and so forth, people dying, they're automatically brought to the emergency room. So it becomes,
It's an alert.
it's an alert.
Right.
And some children even, some children will inform their parents or professionals, the teacher, or show them an Instagram or a message on the internet where the child said they were going to kill themselves, or that they had taken pills, or that they had tried to hang themselves, or you see a lot of the cutting. You see many, and they hide it.
I'm wondering, this gets me right into this conversation around depression and anxiety. Talk to us about how one can tell if someone is depressed, or what it means to have an anxiety, disorder.
Mm-hmm. Mm-hmm. So typically when we're talking about young children, mood disorders, unipolar depression or a bipolar depression, that usually starts percolating in the youth, which is around between 5 to 12 years old. And it's usually chronic illness. And without treatment, it lasts about 2 years or more. So as this mood disorder is percolating, it's it's all internal. So they're withdrawing, they're isolating, they're not going to school, their grades are declining. So there's a lot of warning signs around it. And so this is kind of what perpetuates the suicidal thinking and the suicide attempts. You know, it's very rare to have a successful first suicide attempt in childhood. So they're always attempting, and they're always thinking about different ways to do things, and they're all not really assessing the severity of or the consequences.
Why wouldn't a parent know? Meaning, I'm wondering, and this is not to make any parent feel bad, but if you have a young child that takes their life, what does that say, or does it say about your parenting? You're being responsible for the child, knowing what the child's doing, understanding the child's mental state.
I'm wondering about the phrasing in that I want to be a little careful because there is that underlying reality that perhaps the parent does have something to do with whatever the situation is that the child is facing. And that's a very big reality for all of us as parents. In the society we're in right now, culturally, no matter what our diverse cultures are, we're so busy taking care of what we need to take care of.
Right.
Okay, aspiring for the higher position, aspiring for our children to have the latest clothing, the latest shoes. Sometimes
So you're
we
speaking
are
of our
so,
values.
Yes.
Right.
Sometimes the parents are so out of touch, and I'm finding it within the school systems, within the churches, so out of touch with what they're feeling themselves. How could they possibly
And so
identify
to
with what the children are feeling?
To piggyback on that, I think also because the parents are so self-absorbed and trying to figure themselves out, there's no supervision. So they're neglecting to supervise young children, which, I mean, children need constant supervision, right?
Right.
And so the less you supervise them, then the more time they have to be on social media, to go out and hang out with peers that are not very good for them and be influenced in a negative way.
I think also, you know, it has a lot to do. First of all, when we speak about mental illness or a serious mental illness with children, there's a genetic predisposition. So
Okay.
you're also looking at parents that have their own limitations because of their own genetic predisposition to the similar illness or the depression. There's also some parents are very limited in their knowledge, you know, it's developmental delay, whether it's cultural limitations, exposure, just not knowing, you know, and I'm not trying to say ignorance, but just really having a naivete to some of this stuff as parents, you know, newly arrived immigrants who, as we spoke earlier, struggling to survive and don't see some of these.
The signs.
Well, how about some of these young children that were coming over the border and they dead, you know, because, you know, they made this very long, excruciating trip for a child, but yet the parent wanted a better life for themselves and their family.
A lot of it is stigma, too.
That's what I was
Very
Right.
big stigma.
Let's talk about stigma and how that inhibits.
Yeah.
It takes a while for them to really be cognizant that they are suffering themselves. And this is, you know, to be able to help your child, you have to help yourself.
Right.
So, you know, and then just being in denial.
In denial, and I've come in contact with some parents that they don't want to know. They don't want other people to know because of the stigma around it and their social standing. And it seems horrible because when I encountered it, I was appalled, but it's almost saying everything is going to be all right. We just don't need to talk about this, and nothing really exists. And it's not even that they don't know it, but they don't want to know it. So, and some people don't know what to do with it when they do even
They
know
fear the unknown, I think. I think they view it as a weakness or as some sort of like a curse. That's, you know,
curse.
a curse or, you know, just something bad that, you know, it's just unspeakable. But I think that's where we have to start dispelling the myth.
And I'd like to talk a little bit about the stages of cognitive brain development in young people, because oftentimes, and I think I've spoken about this on prior episodes, where you'll see a young child at a funeral and they're playing tag around the casket, but their parent is just passed. So can you talk to us about that? Because I wonder if viewers understand that children aren't little people.
Right. right? That's a common. That's
Or little adults, yeah.
right. Children are not
Little adults.
Little adults, yeah. So their brains are still developing, right? So how would they be able? So they're processing and they're doing things at a very different level than an adult would, right? So, say a preschool child is the concept of death or the concept of, going away forever is. I mean, that's not something they can process.
Right.
They're too busy their thinking and thought process at that age is more symbolic. It's very egocentric. It's all about me. The world revolves around me, nothing else. They can't see things from another point of view. And by age 7, they start understanding, that death is irreversible. And so when a child makes threats of wanting to hurt themselves or attempt suicide, it's usually because there's sexual or physical abuse that they've under.
I've actually seen that many of our children are so engrossed in taking on the role of the adult. In many instances, they're so busy hiding their feeling so that they can protect the parent in a situation like death and dying. Everyone who's adult around them is in trauma. The child is not acknowledged, but yet the child is not allowed to feel or even speak about what's going on within them. And in most cases, they're not even given any bereavement counseling after the event. So how do we really know what's going on with the children until we see them act out and perhaps label them suicidal or all the other labels we have? We, once again, as adults, are not addressing our problem. And our children are very empathic.
And that's what.
And what do you mean when you say empathic?
When I say empathic, think about a little baby and you walk in the room. The baby will respond to one person, but there can be another person. That baby will scream. And we ask ourselves, what's happening? They pick up every nuance, every sense, everything that's going on. Children know. And the ones that we have right now are even more sensitive. And that might be one of the elements that's triggering greater levels of suicide.
Yeah, because I've always found it interesting how a baby face will light up
correct.
when they see somebody that they love come through the door, or somebody that they've had positive interactions with.
And it's very important with the children to help them to develop a relationship with another supportive person. Many times children, in the hospital they wish that they could be with, they do things or they become withdrawn or try to hurt themselves so they can be with that person in heaven. You're talking about developmental level. They want to they want to be with grandma. So you have to give them pictures of grandma. You have to help them connect with their family members and be in reality, but respect the fact that, and one child, was telling me a story about music where she listens to gospel and that's her connection with grandma, the lost parent, or it's very interesting how you have to begin to help them reconnect with other people in their families to respect their feelings at that age. And
So Brenda brought up a good point that I wanted to actually elaborate on, being the parentified adult. That's what happens when children are absorbing the trauma. They're seeing it, they're taking it in, but they don't have the skill to express it or vocalize it. And so that's why it becomes so tricky.
It's very tricky. I have a 13-year-old who both parents are veterans and about to be deployed.
But at the same time. Yeah. That's
Okay, well, months apart. One just left and another one's going to leave. And she had begun to self-mutilate.